My name is Nancy Davis and I'm an academic advisor for the Health Sciences programs. You may see on your agenda that it says Dr. Linda North, but she sends her regrets. She was not able to be here today, and she wanted me to tell you a little bit about what we have to offer in the Health Sciences division. First of all, we offer some individual courses. We offer some physical education courses. Many of these courses will transfer into a 4-year degree if your degree requires it. We offer everything from bowling, tennis, golf, all kinds of physical education courses. You could even take those for your enjoyment if you need an extra hour. So just think about those if you're looking for an extra class to take to fill in your schedule if you need to be a full-time student. Also, we have some health education courses. Some of these courses also transfer to the 4-year colleges in certain majors like athletic training and health promotion, that type of thing. So we offer those programs. Also, they're important programs or courses that may help you if you're planning on a field in healthcare, because they do talk about a lot of issues in the healthcare fields. The rest of the things that we have to offer are healthcare programs. Healthcare is a very rewarding field, and it can be a well-paying field. And so some of you may be thinking about starting your college career in the healthcare program. We have several that we have to offer here, and I just want to run very quickly through those. I won't take much more of your time. I know you're ready to get up and stretch a little bit. The first thing that we have is a nursing assistant program. A CNA is a person who works in a long-term care facility. They also work in hospitals and in doctor's offices. That nursing assistant program that we have is simply a training program to allow you to take the certification exam to be a certified nurse's assistant. It's a 10-week training program, so it's not even a full semester long. However, it is not a college credit course. It is continuing education, so therefore financial aid doesn't cover it, but it is one of our popular programs. We get a lot of calls about our nursing assistant program. So if you're interested in it, we do have one starting this fall, and we can still talk to you about it. It's not too late to get into it. Another one that we have that we still have openings in is our therapeutic massage program. Now that program is offered down on our downtown campus. It's an evening program. And once you finish it, you're eligible to take the licensure exam to be a licensed massage therapist. You can make anywhere from $30 to $60 an hour as a licensed massage therapist, depending on whether you work on your own or whether you work for someone else. But that program is 1 year long, and it has really no admission requirements. So if you're interested in it, you are eligible to sign up for it. However, there is a limited number of students we can take in that program. So you need not to wait if you do plan to start it. If you're not sure, we also started in the spring semester. So if you need to talk about it, I'll be happy to talk a little bit more with you about that program. Another program that we also have openings in for the fall is the EMT Basic program. Now there is something that you have to do for this program. You have to meet a certain GPA requirement, either from high school or if you have previous college experience. And you will be able to take it this fall if you meet that requirement. It's a 1 semester long program to allow you to be an EMT Basic. And if you're not sure what they do, they're the people that work on the ambulance, or they work at the hospital as a transporter, or they may even be an ER tech in the hospital. And that's not really a bad job for anybody who just spends 1 semester in that program. There is a national certification exam that you take after you finish it in order to get your license. So you see a recurring theme here. The rest of these programs that we have do have licensure exams after you finish these programs, and that's one thing that's distinctive to all of our healthcare programs, is that you do have to take a licensure exam. Now with the rest of these programs, there is a separate application process that you have to go through. You have to be accepted into these other programs. We have certain times of year that we start the programs. There are certain requirements, and you have to apply and be accepted into it. Many of them are competitive, so your grades are going to be an important decision about whether you get into these programs or not. So while you're starting out, if you're not quite sure what you want to do, we can guide you into getting courses, but it's up to you to make sure that you make the grades it's going to take for you to get into these other programs. Now the rest of these programs that you do have to apply and be accepted into are the paramedic program. You have to go through the EMT Basic first. You have to meet certain requirements and apply for acceptance to it, and we start it once a year. That's a person who would drive the ambulance, or they might work in the ER. So that's a very rewarding field. We also have a way for those paramedic students to go on and get into the nursing program in a short track, what we call the paramedic mobility program. So you can keep on going past the paramedic program if you want to be a nurse. And a lot of people like to do that if they like the emergency side of the medicine field. They like that excitement of being the first on the scene and being the one to give the first aid care when a person is injured. The next thing that we have is our radiologic technology program. It is a person who is the x-ray technician in the hospital. If you've been in and had x-rays, those people are x-ray technicians. We start that program once a year. Again, there are requirements and you have to apply for it. It's too late to apply for it this fall, but what we'll do today is help you get into some academic courses to get started working towards getting into it at our next deadline date. That is the 2-year associate degree program. Once you finish it, you may decide to continue your education and go on and become a CT tech or an MRI tech to increase your earning potential and increase your valuability to your employer. They find it more desirable to have an employee who can do a wide variety of tests, so they're willing to pay you more if you decide to go on and increase your certifications in those areas. So we do offer those other 2 programs, but you have to go through the Rad Tech program first before you can become an MRI tech or a CT tech. The next things are nursing programs. We have 2 nursing programs. One is our practical nursing program. It is on the Wadley campus, and it's a 1-year program that we admit into once a year. Once you finish that program, you're eligible to take the licensure exam and work under the supervision of a doctor in their offices or under an RN on the hospital floor, or work in the long-term care facilities. After you finish that program, if you desire, we do have a mobility program to allow you to come back and to finish up the last half of the RN program. So some people need the LPN step ladder actually to allow them to go to work at a faster pace, and then they can come back and finish the rest of their degree to become an RN, hopefully go on and get their bachelor's degree, master's degree, doctorate degree. There are many options for you to go on after you finish your RN degree here to increase your education in that field. And the last thing that we have is our registered nursing program, just the straight associate degree program. You do not have to be an LPN for this program. You can apply for it if you meet the requirements, and we accept into this program twice a year. Again, it's not quite time for you to apply, but we will help get you into academic courses for it. And we hope that you'll get into those programs, but they are very competitive, so make sure that you pay attention to your grades. And I'll talk with you a little bit more after we break out into our sessions in a minute about what the requirements are going to be for you to apply to these programs. So if you have any questions, make sure that you contact me. I'm the advisor for the Health Sciences Division. You can just call the school and ask for me, or you're welcome to come out to my office in the Health Sciences building if you have questions.